I'm Dr. Chuck Miller. I'm a practicing reproductive endocrinologist and fertility specialist and minimally invasive gynecologic surgeon in metropolitan Chicago. I've actually been practicing for over 40 years, but still love what I do and feel compelled to continue to help women. So the patient is a 27-year-old gestational carrier. What that means is she was carrying the pregnancy for another couple. Unfortunately, on ultrasound that was performed at approximately 8 weeks gestation, 8 weeks of the pregnancy, there was no further heartbeat noted. That means there was a demise. Ultimately, we have a number of different ways where we can manage a fetal demise, a miscarriage during the first trimester. It could be just emergent therapy, let it happen on its own. It could be medical therapy, and it could be D&C. Unfortunately, all those treatments create their own sets of problems. So we chose to proceed with MyoSure evacuation of the pregnancy under ultrasound guidance. And here is what we are seeing. So we're now coming to the pregnancy. MyoSure XL is now being seen. And I'm now removing the tissue, the products of conception, with the MyoSure. We're seeing it under directly hysteroscopically, but I also have an ultrasound that I can refer to as well. The ultrasound probe is placed on the abdomen. Now, what is interesting about this technique is different than when we deal with fibroids or with polyps. I'm not putting that window directly on the tissue, but rather I'm using the suction to raise the tissue to the instrument. In my mind, that creates less risk of adhesion formation of scar tissue subsequent to the procedure. And now you can see that we're well within the procedure. We're at the point where we have a normal appearing uterine cavity. There's still a little bit of tissue that I will come back and take, but we're constantly evaluating this throughout. With this technique, we have seen very little scar tissue, very little risk of retained products, and we think that this is a game changer when dealing with first trimester loss in patients.